Welcome to the Expert Series brought to you by the Lupus Foundation of America. Today's episode is Vaccine Safety. In lupus, something goes wrong with the immune system, which is the part of the body that fights off viruses, bacteria, and infections. With a compromised immune system, and exposure to something like the flu, shingles, or measles can make someone with lupus very sick. It may even increase lupus activity or cause new flares. So it's important for people with lupus to consult with their rheumatologist and follow their recommendations for getting vaccines. Today, we are happy to introduce Dr. Eliza Chakravarty, Associate Member of Arthritis and Clinical Immunology at the Oklahoma Medical Research Foundation. Today, Dr. Chakravarty will answer your most asked questions about vaccine safety and lupus. Thank you, Dr. Chakravarty, for joining us. So let's get started. Question 1. How can someone with lupus make sure that they have received the appropriate vaccines so they are protected?
Thank you so much for having me today. Well, the ways to assure and document successful vaccination for people with lupus are not really different from the general population. It's always a good idea to keep copies of records of dates of vaccinations, and this is true for everybody, and particularly for yearly flu shots, since there's no blood test that can confirm vaccination for the flu. For some vaccines, blood tests can confirm that you've been vaccinated through antibody levels, and these are regular blood tests that show that the body has seen and recognized the vaccine product. It's really important to remember, however, that no vaccine is 100% effective, so that having had the vaccine and even having positive results on the blood test does not necessarily guarantee that you won't still get the infection. Vaccine responses may weaken over time, and many infectious agents, like the flu, may change over time and invade immune response. It's still important to get vaccinated, though, because a lot of times even partial protection is better than no protection at all. Also, sometimes if you're vaccinated and you still get the infection, you're likely to get a milder form or less severe or shorter version of the infection than you might have if you weren't vaccinated.
Great, thank you. Question number 2. Why are we seeing an increase in the measles? And do people with lupus need a booster?
The increase in measles cases in the United States is largely because many people have decided not to vaccinate their children with MMR and routine childhood vaccine series. Measles actually is a very highly contagious virus, and when enough people in a given population are not vaccinated, the infection can spread rapidly. If you're up to date on your own vaccines and have had the complete childhood series, you do not necessarily need a booster. But it is also important to make sure that everyone in your family, particularly young children, are up to date with all of their vaccines. It's not only good for your health, but also for everyone else, and to prevent the disease from spreading in the population.
Great, thank you. Question number 3. Now there are 2 shingles vaccines. How does someone with lupus know which one to take?
So to start out, several studies have shown that people with lupus have higher risks of getting shingles than healthy people of the same age. And what shingles is it's basically once somebody's had the chickenpox virus, usually as a kid, that virus remains dormant in your body indefinitely after your clinical chickenpox infection resolves. So little virus particles kind of hang out there and are kept in check by your immune system. Sometimes, for a variety of reasons, the immune system check is insufficient, and you might get a local reactivation of the chickenpox virus, or it's called the herpes zoster virus, which will come out usually in one isolated area of the body. And so that is what we call shingles. It's not a new infection. It's basically a reactivation of an infection that has been lying kind of in check in the body. It's clear that people with lupus who are taking high-intensity immunosuppressive medicines for really active lupus, like cyclophosphamide, azathioprine, and even mycophenolate mofetil, may have an increased risk of having the shingles reactivation. We've actually seen that just having lupus, even if your lupus is inactive or you're taking medicines that do not suppress the immune system, still puts people at higher risk of getting shingles than people of the same age who don't have lupus. So we think that probably what's happening is that specific changes in the immune system that are associated with just having lupus may actually put people at higher risk, and it's not necessarily just the heavy-duty medications that we need to treat really severe lupus. So the original shingles vaccine was a live attenuated virus vaccine, and that means that the vaccine was actually made out of herpes zoster virus that had been altered in a lab so that the virus did not cause an active infection. But it was strong enough that the immune system could recognize the virus particles and make a response to it. While this was considered safe for the general population, it hadn't been studied in the lupus population. There were a lot of theoretical concerns that if someone had a really deficient immune system, that somehow someone could acquire the actual infection from the vaccine. This really hasn't been borne out, but really caused a lot of concern and reluctance to vaccinate people with immune system disorders with this attenuated vaccine. Fortunately, though, much more recently, there's been a new vaccine that's been approved for shingles. And this one is recombinant, meaning that it's just a bunch of proteins made in the lab and not made out of an actual whole virus. What's more important, though, is that not only is the theoretical risk of acquiring the infection from the vaccine, is that this new vaccine is actually much more effective in protecting against shingles than the older live vaccine. So in healthy people without immune system disorders, the new vaccine called Shingrix offers about 90% protection compared to 50% protection with the older live attenuated virus vaccine. Now, it's important to keep in mind that the new Shingrix vaccine requires a total of 2 shots, the second one about 2 to 6 months after the first one, and it's really important to complete the entire series. You really need both shots. Unfortunately, though, and this is true for both vaccines, these have been approved in the general population for people 50 years of age and older. And this is just because the risk of getting shingles in people who don't have immune disorders becomes much higher in people after they reach age 50 to 60. Now, it hasn't been studied in large populations. Neither vaccine has been studied in large populations of lupus patients, so that we don't know the exact efficacy rate or rate of protection. And so it hasn't been officially FDA approved for people with lupus. And this may lead to a problem because getting it covered may be an issue.
Thank you. That's very helpful. Question number 4. What about travel? How does someone with lupus know which vaccines to get in order to plan for travel?
Well, the answer to this question depends entirely on where you are traveling, specifically to the country, which country you're traveling, if you're traveling overseas, if you're in a rural area, an urban area, how long you will be there, and actually even what season of the year it is. The Centers for Disease Control, or CDC, has actually a very good website with information about travel vaccines. However, this is a guide, and it's really important, particularly when somebody is immunocompromised, either from an underlying disease or from medications, to see a specialist in travel medicine who can talk to you and individualize a vaccine plan based on your specific travel plans, your disease, your medications, and other factors. It's also important to recognize that it sometimes can take weeks or months for vaccines, once you get them, for them to have the protective effect. So once you have plans to travel, particularly overseas, it's a good idea to visit travel specialists or somebody who specializes in travel medicine early as possible so that the vaccines can be timed to make sure that you have time for your immune system to make the proper protection against whatever you're being vaccinated against. Another thing to consider when planning foreign travel is whether or not medicines need to be adjusted to reduce your risk of getting infections. And that's something that would be discussed in detail with your rheumatologist and maybe even a travel medicine specialist.
Great, thanks. Question number 5. What if someone is allergic to the flu vaccine? Should they get it? What should they do?
This is actually a very important question, and this issue comes up a lot. The key here is that people mean many different things when they say they have an allergy. This particular vaccine is made out of proteins in a lab and no actual virus is present in the preparation. And oftentimes people will develop mild discomfort at the injection site or even some general aches and pains or even flu-like symptoms after having a vaccination. This is not an actual allergy to the vaccine. It's actually the vaccine doing its job and the immune response recognizing the vaccine and making a response to it. So just having flu-like symptoms doesn't mean that you have the flu or that you're having an adverse reaction. It's just you're having a normal reaction to a vaccine. Usually when it's the case, things like Tylenol and Advil will help, and it resolves on its own in a few days to a week or so. Luckily, true flu vaccine allergies are extremely rare. Whenever anybody gets a flu shot, you get a brief questionnaire asking about egg allergies and if you've had any history of a syndrome called Guillain-Barré syndrome, which is a rare autoimmune-like condition that causes severe muscle weakness. And that identifies people who may be at increased risk for a true allergy, and also people for whom the risks and the benefits of flu vaccine need to be much more individualized. And if you have questions, again, you can discuss this with your rheumatologist or your primary care practitioner.
Question number 6. So, do family members need to get more vaccines?
In general, it is important for everyone to stay up to date on all of their vaccines, not only for their own health, but to reduce the spread of infections to others in the community, and particularly to spread it to people for whom infections may be of increased risk because of immune system disorders or medications that affect the immune system. But a family member of somebody with lupus does not necessarily need extra vaccines over that which is recommended for the general population.
Question number 7. If someone is going to be around a newborn and they've been instructed to get a booster Tdap vaccine, that's the Tetanus, Diphtheria, and Pertussis vaccine, what should they do? How often is this booster needed?
In general, the complete Tdap vaccine is given once, and then you get a routine booster shot against tetanus and diphtheria about every 10 years. It is very safe to receive another tetanus shot booster if you can't remember when your last one was, and this often happens if you have an injury or a cut that may put you at risk for tetanus, and in the emergency room or urgent care, they'll just go ahead and give you another one. This is true for people in the general population and isn't different for folks with lupus or all their autoimmune diseases.
Question number 8. So then what can someone do if they've had an adverse reaction to a vaccine?
This is very important for everyone in the population, including people with lupus and people who don't have lupus. Actually, to look at this issue very specifically, the government has set up a reporting system for anyone who suspects that they've had an adverse reaction to any vaccine. The Vaccine Adverse Events Reporting System is a national reporting system to help identify any signals regarding adverse events that may be associated with vaccines. It's open for anyone to use. You can look it up on the internet, and should be done if you suspect an adverse reaction, because this way people can identify if there are signals of very rare vaccine reactions that may not be apparent early on or may not be apparent until enough people have had exposures.
Question number 9. And if someone has had an adverse reaction, how can they document it and provide evidence so they don't have to take that vaccine again?
If you think you might have had an adverse reaction from a vaccine, it's important to see a healthcare provider quickly, not only to document the event, but just to make sure that your health is okay and you don't need any specific treatments to keep you healthy. The provider may also determine whether the event is possibly due to the vaccination or maybe due to something else that happened at the same time. And that person, that practitioner, can write a brief letter that explains the reaction it's associated with the vaccine, and that can be put in anybody's medication list or allergy list in any health record. Also recommend that everyone keep a copy of that letter from the healthcare provider about a potential adverse reaction so that this can be documented if somebody needs further documentation. I would keep that along with vaccine dates and records. That is part of anybody's healthcare record that they should have a personal copy of.
Thank you, Dr. Chakravarty, for all the great information you shared today about the importance of vaccines and vaccine safety with lupus. For more resources, we invite you to check out the National Resource Center on Lupus to find helpful tools and guides for lupus. For a more tailored learning experience on how to manage lupus, sign up for the Take Charge email series at lupus.org/take-charge. And to connect with others affected by lupus, you can check out topical conversations at Lupus Connect. Thank you, and have a wonderful day. Welcome to the Expert Series, brought to you by the Lupus Foundation of America. Today's episode is Vaccine Safety. In lupus, something goes wrong.